typically the first thing that happens when you come into the office is that there's a little bit of paperwork, some consent forms, and the one thing I would say about that is that there should be no new information in the consent form that you haven't heard or discussed with the surgeon previously, and if there is, you should feel free to ask a question to clarify anything that isn't clear to you. Typically also there'll be some medical information that's taken again on the day of treatment just to confirm any medications that you're taking or allergies to medication. All of this has been documented previously, but it's just confirmed on the day of procedure for safety purposes. The next step after the paperwork is to take photographs. These are medical photographs and are primarily used for documentation of the results of the procedure. And in the treatment room, either a nurse or the doctor will go over the medical history again to confirm allergies, medications, vital signs such as blood pressure, pulse, respiratory rate are taken before anything is done. And then typically at that point, the surgeon will come in, greet you, go over the plan again, answer any questions that you have about the procedure. That typically may be the point, for example, if you're going to have your hairline restored, that the surgeon will map out and design the hairline. That can take quite a bit of time because most surgeons take quite a bit of detail into the design. You will be given some sort of sedation. It can either be oral sedation or there can be even mild intravenous sedation. You really should not have any pain or discomfort during the donor harvesting or during the receptor aspect. I always emphasize to patients that even though these procedures take several hours to do, it is a comfortable experience. It's not going to be an ordeal. During the process, you might have a little bit of discomfort, but certainly you should not be expecting that you would really have any significant pain during the procedure. The next step of the procedure is to identify the donor area, and that area has to be prepared with shaving. In most practices, I believe that the surgeon themselves do that, although they may delegate that to an assistant. Then local anesthesia is administered, and local anesthesia is given by injection. There are many methods that surgeons use to be able to minimize any discomfort of that, and because of the mild sedation, generally patients experience that as really being a very mild and easily tolerated process of local anesthesia. Most procedures will begin with donor harvesting. You may be in a sitting position or a lying position for that. There are some times when the doctor will start with the what we call recipient aspect of the treatment first, and that means that the anesthesia will be done in the area where you're going to have the hair transplant, and then the doctor will make superficial receptor sites, which are very small incisions in the skin, first, and then they will move to the harvesting process. But I think that's probably a minority. Most of the time the donor harvesting happens first. The donor harvesting, if it's an extraction procedure, typically the physician is there doing most of the extractions. If it's a follicular unit transplant, then the physician will be there removing and suturing, completing that. After that, the harvesting, typically you may have a break period, and because if it's a follicular unit transplant, the dissection process can go on for several hours, at least 2 or 3 hours, and so if the harvesting is done, the doctor may wait a little bit before he starts the receptor sites. And even with follicular unit extraction, there may be a small break period before the receptor sites are done. At some point, you'll probably have an opportunity for restroom, stretch breaks. Many practices, you'll actually have a chance to eat a little bit during the course of the day. Receptor sites are almost always made by the physician. Some doctors make the sites before the grafts are placed. Some will make the receptor sites as the grafts are placed. In most practices, it is the nurses and technicians who place the grafts, but there are some practices in which the physician themselves place the grafts. I think in all established practices, whether it's the physician, the nurses, or technicians, these are trained and skilled individuals who do this process routinely. Once all of the grafts have been placed, then typically there'll be a little bit of cleaning. There may be some application of some dressings or ointments to be able to protect both the area that was harvested and the area that was transplanted. At that point, the doctor, the nurses will go over the post-operative instructions with you in great detail. I think typically in most practices there's an extensive written instruction, but also the practice is to go over those instructions verbally in great detail. And in some practices you even get a video that shows you how to follow the post-operative instructions. At that point, in most practices, there'll be some post-operative photographs that are taken, once again for medical purposes, to document what in fact was done. And then you'll be signed out, typically making an appointment for follow-up for your post-operative